Morning, testing 1 2 3 4, testing 1 2 3 4, testing 1 2 3 4 5 6.
All right. Do you want to wait for commissioners? Have we texted anybody? What? Oh, that's right. Anyone want water in advance?
I'm good, thank you. I appreciate it.
Only me, okay.
They're asking us to scoot over a little bit. Yep. I think we're in balance.
Let me just make sure nobody's obscured by signs. No, that's cool. All right, Taylor, you tell me. All right, good morning, everybody.
Good morning.
Thank you all for being here. I want to thank Dr. Arnold Turner, Chief Hospital Executive, Providence Hospital, and congratulate him on the Leapfrog Award that we got this week for a top general hospital. Dr. Kiran Joshi, who's Chief Executive Officer, Cook County Department of Public Health. Dr. Sharon Irons, Medical Director, Ambulatory Services, Cook County Health. Matt Davidson, the CEO of NAMI, Chicago. And Dr. Makaitis, who couldn't be with us today, but I want to acknowledge him as well. My message today is a simple one. If you want to fully enjoy the holiday season, you have to put your health first. That's one of the most important things we can do for ourselves and the people we love. Many of us know flu and COVID are circulating right now, and no one wants illness to disrupt a time meant for family and connection. A fever is not festive, and prevention matters. So if you haven't already done so, I encourage you to make an appointment to ensure you're up to date on your flu and COVID vaccinations. When you get vaccinated, you're not only protecting yourself, you're helping to protect a grandparent, a newborn, a neighbor with a compromised immune system. That's how we take care of each other as a community. Think of vaccines as an essential holiday preparation. They're safe, widely available, and effective, and provide a peace of mind that allows us to gather, celebrate, and enjoy the moments that matter most. Physical health is only part of the picture, however. I also want to speak candidly about mental health. The holidays can be joyful, but they can also be stressful, isolating, or emotionally draining. We may see polished images on social media, but real life is far more complicated. If you're feeling overwhelmed, grieving, or simply running on empty, please know that you're not alone and that it's okay to ask for help. Reaching out is a sign of strength, not weakness. Cook County is proud to invest resources in community-based organizations like NAMI, Chicago's and their Chicago's Helpline, and other free support services for residents when times are tough. These programs reflect our commitment to meeting people where they are and ensuring help is available when it's needed most. And if you're concerned about someone else, I encourage you to make the call, send the text, or check with a simple question. How are you really doing? These small acts of care can make a meaningful difference. As we close out the year, let us commit to caring for our bodies, our minds, and one another. So get your shots, pay attention to your mental health, and give yourself permission to rest and recharge. By doing so, you will be better able to fully enjoy the time you share with those you love. On behalf of Cook County, I wish you and your families a healthy, peaceful, and joyful holiday season. And now, I'm going to introduce Dr. Turner, and I would ask that each person introduce the speaker that follows. Thank you so much.
Thank you, President Preckwinkle. Good morning.
Good morning.
My name is Dr. Arnold F. Turner. I'm the Chief Hospital Executive for Cook County Health's Providence Hospital. Thank you all for joining us today. On behalf of the Cook County Health Leadership Team, including Dr. Makaitis, I want to express my appreciation to President Preckwinkle, the Cook County Board of Commissioners, and the Cook County Health Board of Directors. This is a challenging time in healthcare, but they continue to champion the work we are doing. Their support of our mission allows us to be a resource for so many people. And as we head into respiratory virus season, that is especially important. I would also like to recognize the team from NAMI Chicago. In April, Cook County Health and NAMI announced expanded efforts to increase access to mental health support in Cook County. This time of year can be difficult for those dealing with mental health crisis, and I'm grateful to them for joining us today to talk about the work being done. The holiday season is a time of celebration, but it is also a time when many people put their health on hold, be it physical or emotional, to care for others. Ignoring symptoms doesn't make them go away. Getting care early keeps small problems from becoming big ones. The experts are gathered here today to offer reminders about why it's so important to care for yourself, particularly at this time of year. Studies show that there are increased hospitalizations during the holiday season. More seasonal illnesses like flu and stomach bugs, more accidents, higher stress, delayed care that leads to worsening conditions. Our hope is that these reminders will help keep people out of the emergency room and at home with their loved ones. Listening to your body is the best gift you can give yourself. Thank you. And now I want to introduce Dr. Karen Josie, Chief Executive Officer, Cook County Department of Public Health.
Good morning. Thank you, Dr. Turner. Pardon me. Thank you, Dr. Turner. Thank you, Madam President, for your leadership. It's such an honor to be here this morning with all of our partners from Cook County Health as well as NAMI. As we enter the holiday season, we need to prepare for a possible severe flu season and for increased risk of COVID hospitalizations as compared to last year. I want to remind everyone that the most effective way to protect yourself from severe illness is very simple. Get both your flu and COVID vaccinations, ideally before you gather with friends and family. I want to briefly share some context that may be helpful as to what we're seeing with seasonal viruses this year. Last year, with respect to flu, we experienced a very severe season in suburban Cook County and nationally, including many, many ICU cases. While back-to-back severe seasons are uncommon, they can happen, particularly when vaccination rates are low. Flu cases typically increase between December and February, and we're already seeing more hospital admissions and emergency room visits, particularly among children. Flu often starts with kids and then spreads quickly to adults and seniors who are most vulnerable, particularly during holiday gatherings. Regarding COVID-19, we are beginning to see increases there. While activity is currently low, emergency room visits are rising, and national forecasts suggest that we may see more COVID-19 hospitalizations this season than the last year. Unfortunately, fewer people are choosing to be vaccinated against both flu and COVID, particularly children, leaving more of us vulnerable. We're also seeing a rise in norovirus cases. This is often called the common stomach bug. It spreads very easily during winter months and can cause severe vomiting and diarrhea. Very unpleasant. The best way to prevent norovirus is washing your hands thoroughly with soap and water, as hand sanitizer is less effective against it. I want to leave you with 4 clear actions that all Cook County residents can take to stay safe and healthy this holiday season. First, reject misinformation. Vaccine misinformation is widespread and often not based in science. As a physician, I've cared for many patients over the years, both hospitalized and in the office with flu and with COVID. Flu is not mild for everyone. Even healthy adults and particularly seniors can become seriously ill. Flu vaccines are like seatbelts. They don't prevent against every infection, but they significantly reduce the risk of severe illness, hospitalization, and death. That protection matters. Second, get vaccinated. It's not too early to get your flu and COVID shots. Vaccines take a few weeks to build protection, so getting vaccinated now, getting vaccinated early, can help protect before cases rise further and before holiday gatherings. Higher vaccination rates across our communities also help prevent those most at risk. Cook County Health offers free flu and COVID vaccines for people 6 months and older. At our Cook County Department of Public Health Saturday walk-in clinics at Blue Island, Fort Heights, Robbins, and Arlington Heights, and North Riverside, vaccines are available regardless of insurance or immigration status. Clinics will be running through March 28th. Please visit cookcountypublichealth.org for more information. Third, practice good hygiene. Cover your cough, clean frequently touched surfaces, and wash your hands often, especially to prevent norovirus, where hand washing is the most effective defense. And finally, to close, if you're sick, please stay home. Staying home until you're feeling better and fever-free helps protect your family, your coworkers, and our communities. These simple actions can help keep Cook County healthier this winter. Thank you. And now I'm pleased to turn it over to my colleague, Dr. Sharon Irons, Medical Director for Ambulatory Services at Cook County Health. Thanks.
Thank you, Dr. Joshi. Thank you, Madam President and team. So good morning again. Good morning. I'm Dr. Sharon Irons. I'm an internal medicine physician here at Cook County Health and Medical Director of Ambulatory Services. So as we all know, the holiday is like really a busy time. And it's also a time where folks can really begin to neglect their health because there's other priorities. They're not necessarily doing it on purpose, but we want to say here, don't forget about your health over this holiday season. So routine care and preventive care often cannot just be put off until the next year. So if you are due for an annual, a physical, recommended cancer screenings, like breast cancer screening with mammogram, prostate cancer screening, colon cancer screening, and a number of other preventive screenings, please go ahead, make the appointments to get those done. You may have lab work that's needed as well. You may have medication refills. Again, oftentimes, we will put those things off because we'll say, well, I'll wait until after the holidays, I'm going to wait. And sometimes we're even symptomatic. We might have shortness of breath. We might have a cough. We might have some chest pain. We might have some diarrhea, fever, chills. A number of things could be going on, but there is that tendency to say, you know what, it's the holiday season, it's Christmas time, it's New Year's, I think this can wait. But we don't want folks to do that. And the reason is a lot of times something starts small, but in no time at all, it can really blow up to the point where you might even need to have a hospital admission, and then you're really sick at that point. So we really want folks to really put their health and prioritize it during this holiday season. Just to really stay on top of things. So, and many folks have chronic health conditions like diabetes, high blood pressure, heart disease, asthma, different pulmonary diseases. And again, because of this holiday season, there might be a tendency to, not eat as healthy. But what we do ask is not to overindulge. It is the holiday season, and we want folks to do things, but in moderation, because we still want you to take care of your health. We want to keep you out of the emergency room. We want to keep you out of the hospital. So again, even as life gets hectic, it's important for you to stay on top of these issues. And we talked about the importance of medication refills, not letting yourself run out. So make those appointments with your healthcare provider. And then finally, I want to remind folks about Cook County Health's Express Care, which really can simplify your life if you're feeling sick and you don't feel like you have the time to come to the hospital, to the clinic. Now, as a doctor and an internist, I'm always going to encourage you, please come in for those appointments. That's important. But for whatever reason, if you can't make it, if there's some other issue, or you feel like, well, I'm just not going to go in, and people feel that way, we do have the Express Care, which is a virtual immediate care platform with telehealth and televideo. Very important for you to know that we have that, and we offer that at Cook County Health. So you can find out more about that by visiting cookcountyhealth.org. express care for more information. And again, as Dr. Joshi mentioned, we are heading into the middle of the respiratory season. We're already in it, right? And then there's the norovirus and, you know, the stomach bug and all of that. We just want everyone to take care of themselves, to understand that we are here. So remember, we also have that express care. So if you need care, please don't hesitate to seek it, regardless of your insurance status, immigration status, ability to pay. We are here for you. Thank you very much, and I will now introduce Matt Davison, CEO, NAMI Chicago.
Good morning. Good morning. Thank you to Madam President. Thank you to Cook County. On behalf of NAMI Chicago, it's always a good time during the holidays to remind and remember mental health care is health care. And it's important to check in with yourselves and with one another during times like these. The holiday season is filled with moments where we're taking things onto our calendar and maybe not making enough time for ourselves. It's important to take time to slow down and check in with yourself to see if you need that extra assistance, if someone in your family might need to be checked in on. As mentioned earlier, this is a time where a lot of things are getting amplified in the community about the holiday feelings and joy and things like that, but it's also a time of inner conflict. It evokes grief and feelings of stress for a lot of folks. We're here for you, and we're here for you because of Cook County's investment in mental health, and then they're doing more than just talking the talk. They're actually walking the walk and investing in much-needed mental health resources for our community. At NAMI Chicago, we operate a free and confidential helpline. You can call and text us, and we can get you connected to services you might need, something nearby that takes your insurance. Maybe you don't have insurance. Maybe you just need someone to talk to. The key is you don't have to have it all figured out when you call and reach out to us. You just have to have the phone number, 833-626-4244, and we can help you from there. So, you know, we get over 40,000 calls a year. It's a very stressful time for our community for all sorts of reasons. We welcome the calls, and we want to make sure everyone and anyone is welcome to call, and we will answer for you. Thank you.
Thank you. Any questions? All right, let's move the podium, take a quick picture. Oh, we do have a question.
I have two questions.
Yeah. Hi, Madam President. How are you?
Good morning.
Good morning. First question is on topic. It's about, you know, you're talking about vaccine misinformation. And I guess, can you talk about just, you know, what level of difficulty, if any, has it been for you and your colleagues to get the message across about the importance of getting vaccinated during seasons like this when the federal government has really taken kind of a lukewarm approach to vaccinations?
I'm going to let Dr. Joshi speak to this, but let me just say I'm old enough that I got all the childhood diseases before there were vaccines. It was pretty miserable, right? Mm-hmm. And we should do everything we can to protect our children with childhood vaccines and to protect ourselves as adults with things like COVID vaccines and flu vaccines. So, as to the misinformation, Dr. Joshi.
Thank you, ma'am, and thank you for that question. So first, let me say that public health policy is absolutely critical. It impacts all of our health. We must take the policymaking process very seriously. That process must be transparent. It must be grounded in science, and it should be made thoughtfully. We're very fortunate in Cook County and in the state to have elected leaders that see that and are incredibly supportive of public health policy, and it's our intention to continue in that way. With respect to recent changes in vaccine policy and recommendations specifically, we continue to recommend the birth dose hepatitis B vaccine because that is what's supported by the science. It's also important to say that we're staying the course there. And the change that's been recommended at the federal level is just that, a change away from an established norm and an established evidence-based public health policy. Thank you.
Got it. And then, Madam President, my last question is, this is off topic, but the state of Illinois came out with a report earlier this month where it talked about, among other things, PPP loan fraud, and how in the last couple of years, since these loans were made available to the American public, there had been 378 state employees or cases that they found state employees had presented false information to acquire PPP loans. But the state of Illinois isn't the only unit of government that has been affected by this. There have been employees from government entities around the country who've been found to have committed this kind of fraud, including in Cook County. I know in one of the Inspector General reports, this has been addressed in Cook County. I guess, like in the last few years as a government leader, can you talk about lessons learned from this? What have has your administration done to perhaps get the word out to Cook County employees, like this is not the right thing to do? Is there anything that has been done or can be done on your end to make sure that this kind of thing doesn't happen again?
Well, the first thing I'd say is, we have like 22,000 county employees. Any group of 22,000 people, there are going to be a few people who aren't going to play by the rules or who are going to take advantage of their position. The overwhelming majority of our county employees work hard every day on behalf of the citizens of Cook County, and I'm proud of them. And as to those handful of folks who haven't behaved well, the Inspector General for Cook County has conducted a number of investigations and recommended disciplinary action against some folks.
Okay, that's all I have. Thank you.
Thank you. We're going to take a group picture really quick. Thank you so much, sir.